This is our first formula. This is the sort of formula that you're going to choose for a PCOS patient with stubborn weight gain, who's having very few, if any, menstrual cycles, i.e. the Chong and the Ren are very, very obstructed. So we start here with a famous mobilizing phlegm formula, arch and tongue, which is just two herbs, as you know, just Chempi and Banchia. And then we expanded a lot. We're going to look at using Sang Fu Da Tan Tang, some of the elements of that, which is a formula that's used to guide out phlegm and damp. And then we're going to combine it with a more modern formula, which is called Bushen Huatan Tang, which is one that also clears out phlegm, but also supports the kidneys. So, first of all, we try and promote the spleen function to expel damp. And we do that by the Sangju, Fulin, Sharen, and Chenpi, will all help us to clear damp. The Chenpi and the Foshu will actually move the Qi a little bit so that that damp can be mobilized and moved out. Then what we do is we get some stronger phlegm mobilizing herbs, which is the Banxia, the Zhajiazhi, and the Dananxing and the Zhebeimu. These are the ones that really break up the accumulation of phlegm. And what we want them to do is really dig into those swollen, shiny theca cells in the ovary. We really want to try and break up the phlegm and the accumulations there and try and get inside to those cysts. And we're hoping maybe with this sort of action, or the action of this formula, that we can antagonize the androgens so that we can reverse the follicular atresia. Finally, because we are looking at ovaries and we are looking at fertility here, we add kidney herbs. So we've got Shudi, Shanya, Bugudrit, and Yin Yang, all to support kidney function. And then finally we add Ji Shui Tang, just to help. Once the blood starts to move in the Chong channel, we want to try and help its movement. And we add as a precaution some Jitsu in case there's some heat that has arisen from the accumulated damp phlegm. In some women you'll have to increase that Jitsu. And in some women, if the yin has actually been damaged already, and you can see that on the tongue, you're going to have to be quite careful with a formula like this. You can use it short term, or you can modify it. You can add things like DGP to it to try and protect the yin. You know, one of our clinical conundrums always is clearing damp and protecting yin at the same time. It's very difficult to do clinically, and you really have to juggle. Also, but in a case where the Chong and the Ren are really, really obstructed, you might need to pull out big guns like this formula for a while, and then alternate with yin tonic herbs to protect the yin so you don't damage it. If this person has high androgens and they do have skin problems, you could use a formula like this and add more for the acne and things like that, like the toxic heat removing herbs like Zhuhuadi Ding and Pugong Yin, things like that. So there's lots of ways you can play with this sort of formula. How are we going to use it? We're going to use it as a strong way of trying to really dig out the damp phlegm. Really drill it out if we can. So you might need to take, the patient might need to take this formula for several months, but don't just give them several months and say off you go. Make sure you're checking up on them initially every week or two, and then eventually every month, just to make sure that they are coping okay with their yin. This formula and others that we're talking about today can all be combined with insulin-lowering drugs like metformin or with Clomid if needs be. Acupuncture is going to be very, very useful addition to these to this treatment with the formula, and so we'll talk about that in a moment. If you start to see some improvement, like starts to be a little bit of ovulation, but you still think there's quite a lot of damp phlegm there to move, start alternating this formula with other fertility formulas like Wei Sha Di Wang Wan, which we'll talk about in a moment, or any of the other fertility formulas that you're already familiar with using that support the kidneys. Now, in this category where we're focusing on damp phlegm as our primary pathological factor, there are certain acupuncture points that we might choose. For example, we might like to use a lot of dye channel points here. Like you use the confluent points, gallbladder 41, 3 hit 5, but then use points on the dye channel as well to start local breaking up of that phlegm damp. We will activate the Chong channel by using Chong channel points. So Ren 3 is a point where the Ren and the Chong intersect. Kidney 13 is a good point on the Chong channel that also supports kidneys. Spleen 4, one of the confluent points. And then, of course, in the background, you're going to be supporting the spleen because you're trying to move damp. In the background, you're also supporting the kidneys because we're trying to increase ovarian function. In the background, we want the fluids to move better, so we're going to support and stimulate the 3-heater. And in local points, like abdomen zigong and kidney 14, stomach 28, are all useful points to get the chi moving around the ovaries and help that damp to move. The research that has been done that shows an increase in ovulation frequency, amongst other things, uses stomach 28 and spleen 6 attached with electric leads on the same side, and a low frequency, like between 2 and 10 hertz, and mild to medium sensation. I'll show you that research in a moment. I added colon 11 there for those situations where you think there's some heat has developed.
For more information on this or other ProD live, distance or online courses, please visit www.prodseminars.com.